It is a common thing to notice in our day-to-day OPD. And when patients are dissatisfied, especially osteoarthritis patients, and who need to who visits multiple doctors in their day-to-day, mm, and they are literally most of them are frustrated enough. So what to do, what not to do, and because there is a limitation of osteoarthritis of the knee management. And so, to satisfy all the patients, how to manage the things, there is a need to sort out issues because some point of time you may find that patient is furious on you, and that may affect your rapport with the patient. And once a doctor's reputation with the patient is gone, then there will be a lot of problem in his or her day-to-day practice, day-to-day clinical practice. So, what are the common things that we are seeing? Why are OA patients dissatisfied with us? Now there are multiple factors that leads to this dissatisfaction. Many a time we tend to treat the pain part only, not what are the things that needs to be addressing or that may be troubling the patient. That is the goal. Pain at some point of time they may get tolerant to the pain, and this pain they are having for years they have been able to manage it, but in due course of time there are some goals of their life, day-to-day activities that is get hampered when they start complaining about pain. So always remember, pain is not only a pathology, it can be a psychology, it can be uh, some philosophical things or something that is hampering. And the moment this OA knee pain or OA pain, hip or any part OA pain comes, leaves this pain from the joint and reaches the brain, or you can call it centralization of pain, things become difficult to handle and manage, and that leads to the dissatisfaction of the patient. And that is really a challenge for all of us to manage it. Now, by the time patient turns up to a rehab physician or any physician, patient may have visited multiple doctors with multiple opinion. And in our country, multiple pathies, hemopathy, allopathy, Ayurveda, Unani, Siddha, multiple medications they may have tried. It is just like too many cooks who have spoiled the broth. And in the by the time this grade 4 OA knee patient or severe OA patient is there, they have lost enough money, and that burden or the financial burden is too much, and they will keep complaining, you have spent this much of money, but I did not get pain. You may at some point feel that you patient is blaming you for this complication. You may end up saying, have not asked any money from you. No, it is the patient for you. You are the representative of all the modalities, including the quack or the jhola chap doctor, which he is treating, or over the counter medication that he has paid for. And you are someone whom he wants to listen. Another thing that leads to this dissatisfaction is the misinformation on the social media, this AI generated. It can be Facebook, it can be YouTube, and these are the mainly a big market place where misinformation is being given. With patient always gets hope. Even I see those people or those type of advertisements or those type of misinformation on social media where people are saying that I am going to treat the osteoarthritis completely. Osteoarthritis knee will be all right and a normal. The fact of the matter is, once a deformity is there, no one can make it or change it. Another fear that patient is having is the fear of the injection or the fear of the surgery. Surgeons' fear is always there that they don't want, and they always try to look out for the alternatives to save themselves from the surgery or replacement or whatever. First, all of a sudden, the cost is too much, and then they feel that I may lose some point, and it is some of my vital organ which is going to be replaced. So, whenever we are seeing the patient, we should try to see things in totality. What are the patients? Why patient is upset? What is causing her? Another thing that patient needs to be carried out, that multiple visits to the doctor is costing him daily wages, dailies, is costing him another relative or attendant his day, and if he or she is coming from the periphery, coming to the center, that is taking a lot of time, lot of energy, lot of whole 2 3 persons day-to-day activities or daily activities is, or the occupation is getting compromised. That is also causing it. So what we should do? Patient's expectation is simple. I want a new knee. But the reality is, no one can replace the nature's knee. Thing is, at some point, we do tend to outright say yes to these expectations, or you can end up giving a false hope to the patient. No, just hear the what patient wants to expect. What are his expectations? It may appear that patient wants a new knee. The patient says, will I be completely all right? हम बिल्कुल ठीक हो जाएंगे ना? Then you ask, what do you mean by it? And let the patient explain his expectation, his or her expectations. His or her expectations are very simple. His or her expectations are, I want to go to the market, I want to go and enjoy the party, I want to go to the functions, I want to go to washroom, I want to do my ADL, activities of daily living. But for that, at some point, patient in one line, if you ask patient to say, I want a new knee, no, the reality will be something which round and round and round. So you have to explain detail. For that explanation is very simple if you ask the patient to hear. So, for example, I tell you, recently I gave a prolotherapy to a patient. After second dose of prolotherapy, she came to me and she said, I am feeling better. Then I asked, in what sense? Will you explain? She said, now I am able to stand from the chair. That is a big relief for me without pain. So that lady was more than happy that she is able to now stand without pain from the chair. So that was her expectation. So she willingly has said that she will come for the third dose and then she will try to see. But as her one expectation I am fulfilling, I should be ready for new expectation to come up and work on that. As a rehab physician, yes, we have to look out for new expectations. Patient's expectation is never like perfectly all right, but their way they communicate, it may appear that they want a new knee. First thing. Second thing, what is the analogy that I commonly use to make the patient understand that, look, I am also using this spectacles. I have some problem in my eye, which is permanent, which I cannot sort out, but vision can be improved with the spectacles. The spectacles has not cured my eye, but I am managing it. Similarly, you are also managing with your spectacles. Same thing will happen to your knee. So, simple analogy, which is in correlation and which you can coordinately work with the patient, will be definitely helpful to you. So, the patient's dissatisfaction is pain is one factor. Definitely, pain is one factor. Round the clock, if someone is having pain, that will be there. But dissatisfaction because he or she is not able to climb the stairs because he or she lives in an old house with a bigger step or and so she has to put lot of effort. So difficulty in using those stairs or so some modification in the stairs may help or sort out this dissatisfaction. Only pain in the knee is not a, just ask the patient to do some architectural modification of the stairs. It will be more than enough to sort out. And it does not cost much. It will always cost less than the money patient has spent on the medication. Remember this. Another thing, he or she cannot go to the parties, functions, marriage. Even there are patients which I have seen, they have not attended their grandchildren's marriage because of this knee pain, they cannot sit and watch the marriage ceremony. This is what people, all of us enjoy. And whenever we go to the any marriage, we just tend to sit and see how the marriage is being done. That is a thing that attracts us, which they miss it. That may be dissatisfied. Most of their life, they may have been sitting cross-legged, eating cross-leg sitting, worshipping with a cross-leg, which now they are not able to do. They may all of a sudden find it difficult to manage it. Another cause for the dissatisfaction is, which is common, is that most of the Gen X or older generation, they prefer to use the Indian washroom. All of a sudden, if someone advises them to stop using it, start using the Western washroom, that is very difficult for them to understand. Why this? They may not be comfortable because of the belief or the way they have led their life. So you will find that these patients are half squatting and sitting and passing the urine. So you have to keep explaining them that why you should do it and how you can modify to use the Western washroom. So these is the dissatisfaction. So many times, many people have the habit, the more every time they pass urine, they go and wash their leg. So this patient may find it difficult to do every time I am passing urine, which I was not doing, and it some spills of the that urine will be there on their leg because they are not sitting properly. That will be the cause for the dissatisfaction. Remember, it is not only the pain. So we have to identify what is the true source of dissatisfaction. So the communication skill or strategies is very simple. Very, very, very simple. Always remember how strict you are. Remember the movie Anand. If you have not seen, it is a good movie, Anand, of Amitabh Bachchan and Rajesh Khanna, in which Amitabh Bachchan is a very strict doctor, goes by rule and law. But Rajesh Khanna is a patient, a cancer patient. For him, he is very liberal. He starts him to break the rules of the hospital and is keeps managing things. So every time you are a Satlonda won't work. Okay, so you have to be bit pighalna, you have to be bit liberal. So sometimes you may have the pressure, this nonsense the patient is talking. Why is he or she telling me that he has not attended the grandchildren? I am least bothered. I'm bothered about only muscles and the cartilage. No, not at all. Just hear them out. Let them ventilate out their problems and the grievances. Then only you can give them a proper rehabilitation. Always have empathy. Try to fit in their shoes, which is although everyone has their own shoe size, but try to fit in. Try to manage somehow what is happening in this type. For that, to develop empathy, what I advise you, go to the community and talk with these people. Just keep hearing them, what they are saying. Slowly, slowly, this empathy will develop. What are the problems that are happening, which may look to be silly for you, which may look silly for me, but it is really something that is challenging. If I don't go to my hospital for 5 days, right now I am attending a conference, I won't be attending my hospital for 3, 4 days. Okay, no issues. I am not going to have a financial burden. I am enjoying, I am chilling. But everyone does not have this facility. Few people, if they don't go to their work for even a day, they will miss their meal next day. So always have empathy. Try to understand what is the problem. Never, never, ever dictate your decision. This is the solution, this is the treatment. No, there is always multiple treatment options and always have a shared decision making capacity. So you share whatever decision is being made, what is beneficial for the patient and how it can be done. Take for example, whenever I am advising a patient to who cannot have a change their in Indian washroom into a Western washroom, I do advise them, do you have an old chair? Old wooden chair, just make a hole and sit. All of us are doing it. So this will help. All of a sudden, I cannot just go and say use Western washroom. Completely foolish. So we have to work with them. How to do that? For example, you have to also ask what is the size of your washroom. Whether that one extra chair can be kept in that room in one corner. Whether it is possible or not possible. So everything has to be taken care of. So you have the another option of a foldable commode that can be used. Never ever give a false reassurance or a false hope. That is the most common thing. Everything will be all right. Never do that. Sometimes in our culture, the patient's attendant will come and tell them that other doctor has told my mother that your knee replacement is the only solution, nothing else. Please tell him there are a lot of options. So don't work under the pressure of the attendant. Just explain the patient or the attendant what are the possibilities and what are the limitations of the treatment. So always avoid false reassurance. And always, the moment you remove the false hope or false reassurance, then the patient will start talking about the realistic expectations from you. How to do that? What can be done? I want simple, simple, small things. My patient is more than happy to stand from the chair without pain. That's it. Ask the moment you start fulfilling those small requirements, small changes, the things will change drastically. The dissatisfied person will start developing a rapport with you, and slowly explain OA in a simple language. Always use a simple language, the language which the patient understands. I am one of the most criticized doctors in the doctors community because I do use local accent too frequently. Most of my local accents are not proper. I do speak 4 or 5 languages, but it is not proper. But patients are more than happy hearing 1 or 2 words of that local accent, and those definitely works it. So always remember that our goal is not to reduce pain, but help them move better and live better. Okay. So communication. So there are lot of challenging case scenarios will definitely come up. In spite of whatever you do, you should be prepared that you have patient expecting walk without walking. Patient will come, you gave me an injection, that injection did not work. Okay. You take for example, you gave a prolotherapy. Patient went and had some pain for 3 days, and you forgot to explain that you are supposed to avoid NSAIDs, anti-inflammatory drugs. And he or she went and had an aceclofenac, diclofenac, or Dilona at in the market because over the counter it is easily available. And then they will come and say, doctor, the injection did not work. You may get furious that why the patient is blaming, although I have explained everything. I have explained everything. So these things will come up. That's why you have to explain. Just getting a written consent and a signature on the consent paper never works. It is just for a medical legal requirement, nothing else. It is not for the patient's requirement. It is just to save your skin, not for the welfare of the patient. So, okay, there are many AI generated things. Patient will go and come and tell you, MRI says severe degeneration. What to do now? And all of a sudden, patient will come and see that your treatment plan has some side effects and what to do. So these things will come. So then you have to explain. The analogy for MRI, I always explain to the patient that MRI reporting is done on the basis of a young adult, healthy adult's bone is compared with yours. So this is just like a room. A new painted room will shine more, but that does not mean that my room needs to be painted every day. This is what I say. Is it workable? They will say yes. It is room is workable. There is no need for any paint. So this is how it works. Same applies to this. Whatever there will be a scenario in which painkillers don't help anymore. So what to do? Take a steroid. Somewhere over the counter it is easily available. Patient will be taking steroids. Now, the moment you will say the pain is a predominant thing, and you are asking the patient to avoid steroid, if the osteoarthritis is non-inflammatory, and you may end up explaining the patient that this steroid in the long run lead to osteoporosis and worsening of osteoarthritis. Patient may end up that this doctor does not know anything. I am having pain. I am getting relief from pain from the steroid, and he is saying not to take it. So these are the things which you need to think. Then whenever patient comes and tell you that painkillers don't help anymore, just ask him what is the dose, what is the frequency, how frequently you are doing, what are the activities you are doing. So for painkillers, only pain management won't work. Activities, what are the activities patients is doing? So everything will work. And patient will come and tell you, now a lot of deformities are there. There is no surgery. I don't want surgery. I don't want surgery. This is the thing. How will you say that? How will you manage these patients? Tell them and explain them. Some repair is the need in an old car. This is an analogy I चाहिए. Always use simple analogy. Don't go this. This is the muscle. This is the want. This is the thing that they are going to place. Nothing. Patient will not understand. And one day patient may come up and tell you, I want some stem cell therapy. What will you do then? I don't know. I am not doing it. No. Tell him the limitations of stem cell therapy. When patient comes to me and asks about stem cell therapy, I do explain them. Grade 4, look, these are the results. These are the studies, and the studies are inconclusive in your case. And if you want to go for a research, you are definitely go for the research. It is not in a practical use. The most common in our population, my patient got PRP and I am fine. So always stop at that point. Please don't compare yourself with the others, because when you compare yourself with others, things will change drastically. Why things will change? Because the how you were born up, how were you were bought, what is your age, what was your environment in which you are working, what was your lifestyle, everything is determined. So PRP works according to those multiple factors. So these are the scenarios which you have to explain it. So how to manage the impossible to satisfy patient? Always be smart, set a smart goal. Never try to be over smart. Once you are try to be over smart, you are in deep trouble. So smart means be specific about the disease, make it measurable through multiple scores like WOMAC and all, or through the VAS. Simple things can be done, and set a goal which is achievable. Your patient cannot run. Don't ask that I am going to make you run. No, not at all. I will make you better than today. That's it. And always be realistic and be within a time bound, that I am going to give you this injection this many times, and if it works, well and good. If it does not work, then we have to look out for the alternative, and you have to follow these advices. And whenever there is some small improvement, as I told you in the beginning, my patient was more than happy standing from the chair without pain, and I celebrated that. And always use motivational interviewing, how can be done, and involve the family when appropriate, and always involve the family. Why I'm telling you involve the family? Because our society is like that. If our society is the problem, or a disease is not an individual's problem only, it is a problem of the whole family. Whole family is concerned and bothered and wants to contribute. So if you do a family discussion, definitely it will help in the family patient's rehabilitation. And if things don't manage and patient is damn adamant, I want this or that, you're not able to manage it, we always take help of psychological support from a psychiatrist. There's no harm, even ever indicated. So always discuss the hype, evidence, never the hype. Lot of things are happening. Biggest speech ever, biggest nothing is coming like this. Never, never, never. It may give you benefit of short-term benefit, long-term loss. Your lipo will be gone. Early ONE with high expectation, definitely focus always on education about the disease, exercises, reassurance. These three things has to be get done, and whenever needed, go for the medication, and always a regular follow-up. Moderate OA after failed injection. Always reassess what is the cause for the injection, what was the failure. Rehabilitation and goal setting definitely matters. Severe OA, which is not willing for surgery. Now, multimodal conservative care will be needed, assistive devices will be needed, pain management will be needed, and at some point of time, psychological help will be needed. So, take OPD message, the most successful osteoarthritis treatment is not that eliminates the ache, but it is the one that restores confidence, function, and participation in daily life. When patient understands their condition and become active partner in rehabilitation, satisfaction follows. So this is for the day. If there is any question, please feel free to ask. Okay, thank you everyone. I hope you guys had your tea, and we will meet next week, Friday, same time, with some new topic. And we will continue osteoarthritis for this week or so and some small topics. If there is any idea or anything to be done, definitely welcome. Okay, we will end the recording. Obese elderly patient with OA knee but not ready to reduce weight. Huh. Okay, this is a very, really a good question, and it is very common in patients with obese elderly patients who refuse to reduce weight. Do you know why they refuse to reduce weight? One of the common thing is everyone advises thing go and do exercises, start jogging and running for to reduce weight. It is practically not possible in OA. So you have to tell patient will come, just keep hearing, and then they will say, I know my problem is because of the obesity, but I don't know what to do. And so you will realize this is an excuse that everybody has told him so many times, same thing, that he has started avoiding it. The best thing is, sir, I can help you reduce your weight without walking. First thing, without running. First thing, without compromising on your diet. Let's just start small, small steps. Let's just start working from the exercises which you can do sitting. Patient will be more than happy. Then slowly introduce him that, okay, do you think there is some diet that is troubling you or that is leading to your weight? You will say yes. Reason is obesity and OA knee is a vicious cycle. Because of the obesity, there will be OA knee, and because of the OA knee, there will be worsening of obesity. So things needs to be managed. Counsel them, give them exercises which you can do. Tell them to change the diet, little bit, small, small things. Don't tell them whatever is written in the book. Never. Diet means something which you can prescribe from your the local region or according to local taste. Okay. Take for example, in Bihar, I do advise people to have a sattu. It is a flour made from grams for the protein as well as fiber. It works. Most people are more than happy to have poha and curd as a diet. They will more than happy to have it. All of a sudden, if I go and tell them, don't eat rice, stop eating rice, patient will not be willing for that. Change habit, but slowly. From tomorrow onward, this is your diet. Yeah, nothing. Slow, slow, gradual, gradual. And always explain to the patient what I use is I tell the patients clearly, sir, you have put on weight in due course of time. So we will reduce the weight in due course of time. I am not at all in a hurry. So we will give you time to reduce things. Okay, any other question? One thing always have in mind that if you think that patient is not willing to reduce, let there will start communicating and let the patient talk. Now, a time will come and patient will tell you that I want to do this, but I am not able to do. The moment patient says that, that's it. That is the point he is ready to go ahead with it. Okay. Any other question? So what I advise everyone that if you want to learn communication skill, spend time with the psychiatrist friends. Definitely, they are very good in counseling, hearing. You will learn how patiently they are hearing everything. Definitely, it will be helpful because you have to find out a common path to work with the patient, and then you can set a common goal. Okay, thank you. Okay, so we will. Any other question? Nothing.